Hello, how are you doing? Welcome to the new Ministry of Health. My name is Deron Cloud, and we're getting ready to have one of our first interviews with one of the top professionals in the world. The new Ministry of Health is the ministry where God is truth, where we deal with truth and we bring about wisdom. And we don't say we know everything, but we share our experiences so that you will have solutions. And so I'm so happy that one of my first guests that we're going to have on here, and I might as well not even say that you're a guest, but he is a part of it, and we'll talk about it as we go. Dr. Henri Lamothe, how are you doing? Thank you so much.
Thank you
for doing this. And
my pleasure.
Bear with us as we go through this, because this is a brand new journey on wellness, and we're believing that we're going to bring solutions. And so, in that being the case, before I get started, because oftentimes you see people come on and you have no idea, and they just have a little tagline or CG at the bottom that says Dr. Henri this and such and such and such and such, and then we keep going. But I really want to say, no, can we talk about your qualifications? Can we talk about your life and some of your interests so that I could understand who I'm talking with, and then even those who are in the audience, they will have an opportunity to, as they listen to this interview, find answers and solutions to their problems. And so I looked at some of the credentials. It says you're an emergency physician. You've done that for 25 plus years. What is an emergency physician?
It's a physician that takes care of patients emergently and their problems emergently in the emergency room setting.
Okay. And so in that being the case, and then it said you also are established research scientist. Is there a special field that you are involved in?
Part of being a research scientist has to do with my thought process outside the box from a long time ago, always questioning what we can do better and how we can step out of ourselves and bring scientific research to a number of fields. I've done research in chemistry when I was in college. I've done research in heart physiology when I was in medical school.
Okay.
I've done research in multiple areas of disease processes, including animal lab research and human research, to answer a lot of questions that can add our current understanding of the problems that we have. So the research that I've done is both lab bench research, clinical research, human research, and understanding and bringing a different aspect of questions that have been answered as specific illnesses.
Okay, but I thought I heard some passion. You said long time ago. What does long time ago mean?
I think part of my character is being an individual who thinks outside the box.
Okay.
And what I mean by that is that, in the scientific research fields and scientific education, you can follow or you can set the trend.
Mm-hmm.
I think of myself as more of a trendsetter.
Right.
By questioning the current theories,
right,
adding to its understanding, or debunking some of the understanding.
Okay. And so now I look at this and it says you're the current president of the Academy of the American Association of Emergency Physicians. Now that's a long title and function. Can you explain that to me? What is the Academy of American Association of Emergency Physicians?
There are multiple associations, and the associations have different responsibilities. Part of the certification process of being an emergency physician has two main processes that we go through, both in education and testing, and then you get certified to continue to your profession in that field. The American Academy of Emergency Physicians is part of the American Academy of Physician Specialists that certifies emergency room physicians, and there are thousands and thousands of them throughout the United States. And we set forth to bring up quality physicians to get certified, to be board certified in emergency medicine, of which I'm the current president of that association.
Okay, we have discussed some of your credentials and your association with the emergency room physicians. And we know that you're going to be working with the My Medical Records Online. How does that connect you to My Medical Records Online? And what kind of support would you be bringing to the new Ministry of Health as you begin to work with that ministry?
There are multiple levels of challenges for emergency room physicians, for all emergency room physicians. And part of the challenge is that in order to understand the individual you're about to treat emergently, you need to really understand their medical history. You're not going to find a lot of medical history at 3 o'clock in the morning when your patient is ill.
Right.
So the challenge in emergency medicine is obtaining up-to-date medical records of the patient that you have so you understand their medical history, their medications, the previous procedure that they have done. Once you understand that, then you have a much better understanding of who you have in front of you and how you're going to deal with the emergent problems that they have.
Okay. And so, let me ask you, I'm sorry, were you finished? I'm sorry.
I think it brings forth a different angle to which one enters the medical world as we speak.
Okay.
And your Ministry of Health brings another very important part of our healing process.
Okay.
Speak about the ministries, speak about what you bring forth in terms of emotional healing, spiritual healing. I think it falls right in line with physical healing.
Right.
And that part of medicine, that part of the delivery system, I think has been so far isolated from the rest of medical treatments. We're having now the recognition of pastoral care as part of the hospital healing system. And
Wait a minute, I just want to make sure. Did you say pastoral care as part of the healing?
They're correct.
Wow.
So it's the recognition that in order to heal the body, you have to heal the mind, you have to heal the spirit that's in front of you.
Okay.
So my Ministry of Health brings that aspect of medical care to a very otherwise structured, somewhat isolated way of taking care of emergencies in the emergency department.
I get it. And so now let me ask you, what are you going to bring? Because now once you say you have an understanding of the patient, because I'm now realizing as an emergency room physician, and if you're over, you all really have to have listening ears, because when the patients come in, you have to discern, all right, where is this coming from? And for the first time, I've understood why you guys ask me 1,000 questions when I come into the emergency room, but you're trying to get to something. What function are you bringing to My Medical Records Online in the form of, because I was reading some of it on the medical concierge, and what is that?
Well, once the physician in the emergency room setting is armed with all the information about the patient, giving the right from the patient to open up that information so we can review it, then we have a better idea as to who you are, your medical history, and it is a very important step in understanding who you're trying to treat. So My Medical Records brings a very unique process whereby you give me the opportunity to review your medical records so I can look at your last 10 years of events so I know who I'm talking about today. It's very difficult for the lay public to remember their current medications, their past histories, their operations, what they had done. It's a very complex world of information that is invaluable to the current treating physician and very confusing to most patients. If they have access to 100% of their records And if they have control of 100% of those records, then it makes sense that the individual will have the opportunity
Right.
to provide you with the information that's necessary so that you can better treat them.
And you said something just now. You said if they have control. And so now, and I want those who are listening to this interview know that we have started this new journey. And so it's very organic as we go through the process of reaching and helping so many families. But I want to make sure, I think we should take a moment even right here, because we're working together, but I would like to know, let's establish, what is My Medical Records Online? What is that? What is that? How would we explain that concept?
Well, I'll tell you what the current system is right now. It's confusing, it's somewhat archaic, and it's not in your control. It's the control of whoever's got the record, wherever you were, whether you were in Utah last week or Alaska 2 years ago. It's in the hands of those individuals, not in your own hands.
Okay.
So those important pieces of information are isolated from you. It's very difficult to get. So wherever you are, you don't really own your record until you ask for it.
Right.
Imagine if you were to have an entire history of your first 5 years of events, your birthday, the gifts you had, all of these events could be packed into a medical record if it's a medical history where you control your medical records, you have access to your medical records, and you give the physician emergently access to your medical records. It is a storage bin of information that is stored in the clouds that you can have access to, and it's extremely secure so that only the individuals you give access to through an access code have access to the information that's within it.
Right.
So you gather all that information and you have at least a chronological order of all of your medical history, all of your medications, all of your surgical procedures, all that is gathered in one storage capacity. And that storage capacity is organized in a way such that I, as a physician, can say, okay, you're having abdominal pain. Let's look at what's been going on with you in your gastrointestinal system for the last 20 years. What medications have you been on? And how does that impact the care that you get emergently? It
Right.
does, because then I'll have a history of what your gastrointestinal effects are and what operations were done. That data is not readily available to the lay public today.
So you said something, because I've never heard. This is different. You're saying you give, meaning me as the patient. I know this, but you're saying you give the doctor your information.
Correct.
And so then what we are establishing is a system, and so that you guys understand where you own your medical records, and because they belong to you and you have control over that. And I'm now understanding, with My Medical Records Online, then that means you don't have to go through 4 or 5 days of trying to get them to copy it, send it to your email, or several different conversations.
You mean 4 or 5 months?
Months.
It's very difficult to get this. In the emergency room setting, you have immediate access
Right.
to everything that was done: EKGs, copies of your chest X-rays, copies of your cardiogram if necessary, copies of your echocardiogram to see the function of your heart at 3 in the morning. And if you had that done in Utah and right now you're in Connecticut, you'd have that access. Today, that's not possible. The Utah hospital has your record, and you're not going to get that emergently to me.
And I'm just curious, what's going to happen if I need it now? What is the process going to be like trying to get your medical record? You just the hospital's just going to have to call the other and wait until they connect?
Well, you're not going to get there at 3 in the morning for medical records to send you a copy of a video of somebody's echocardiogram. It just doesn't happen. But if you have your medical record accessible, that will make the physician who's taking care of you emergently well armed. Not that they can't do it now, but the process will be much, much, much better when I know who I'm talking to, when I know what's been done to them, as opposed to remembering. Even drug allergies, so you ask the patient these days is in the middle of the emergency room, pull out of their wallet a piece of paper that they folded 100 times that has scribbles on it,
Right.
and they try to open it up, and the savvier ones come up with a computer, printout of what they've had, and in some cases you have people that come to the emergency room with a stack of paper this high that says, this is my x-rays that were done 20 years ago, this is me, and it's not practical.
And so and I'm glad you brought that up, because on my medical records online, when we talk about allergies, I always there'll be a database that, so say for instance, if you're getting this certain medication, that the system will automatically pick it up and say, no, that does not work with this medication, and you'll notify the patient.
Well, there are multiple ways in which my medical records could be used. For instance, you'll definitely avoid medical errors.
Okay.
Medical errors meaning you don't remember if you were allergic to something, and the doctor, who does not know that you're not allergic to it, gives it to you and you have an allergic reaction. Had you had the data in front of you that you remembered up to date, then that could have been an avoided, potentially deadly situation. So that data is very important. Also, drug side effects and combination of drugs, all of those are important parts of what am I going to treat you with today, emergently, that's not going to harm you.
Right.
And the only way you can know that if you know what's been treated in the past that has potentially reacted to in the past, and you want to avoid those medications or combinations of medications.
Right.
So if you're armed with the history of drug interactions, side effects, medical history, abdominal surgical procedures, all of the above, or CAT scans or MRIs, if you have all this data with you, immediately available to the physician, whether it's 2 in the morning or 2 in the afternoon, you have much better chance of avoiding complications, avoiding medical errors, and avoiding a redundant system that doesn't allow you to access the records as it exists today.
I'm sitting here processing a lot of this information that you have shared with me and shared with the audience, and it makes me really contemplate how important the medical records are. I would like to just take a moment just to take a break, gather ourselves, and I'd like to come back and understand the importance of what the emergency room brings to the wellness journey. And not only that, I'd like to know, what are the plans that you have to be able to make sure that you are the first line of defense so that a patient like myself will be protected. And if we can do that, we can come right back right after this, and that would be great. Is that cool with you?
Do. Absolutely.
Cool beans. Hey, listen, we're gonna come right back. Listen, we're gonna share some more information. Pay it forward. Let somebody else know. Take a look at this. Why? Because we're bringing truth. The new ministry of health is a ministry where God is truth, and we're bringing truth. And we hope that you know that you come first. Talk to you in a minute.